Okay, it's 12 in the morning, but I promised him this guy will make him a video today about his phosphorus. So his phosphorus is really high. If your phosphorus levels are this high, over a 9, it's crucial to take steps to bring it down. High phosphorus can lead to serious complications. It can lead to bone disease. It can lead to heart issues. So definitely you want to control your phosphorus. So check your binders dosage. Make sure that you're taking your binders like you're supposed to. This guy says that he was supposed to take 2 with meals, but his phosphorus is a 9. Taking 2 with meals doesn't sound right. They definitely should have adjusted that. Talk to your doctor, talk to your dietitian. Make sure that the doses that they have you on is appropriate for your phosphorus levels. I don't think it is, though. Ask them if you should be taking it with snacks. You should be taking it with snacks. Ask them how often, tell them how often you eat, tell them if you snack throughout the day, and hopefully they can give you the right prescription for your binders. Make sure you're taking your binders at the right time too. Make sure you're taking them right before you eat your meals. So take your binder and then immediately start eating your meals. Let them know if you're a slow eater. If it takes you 30, 45 minutes to eat, maybe you should take some binders right before you eat and then again mid-meal, because you're taking so long to eat, the binder's ineffective, and then you're just ingesting all this phosphorus. You want to make sure your medication is working properly and preventing the phosphorus from being absorbed. Make sure you're on a phosphorus-free diet. It's hard, but avoid high phosphorus foods. Limit foods that are naturally high in phosphorus, like dairy products, seeds, beans, nuts, chocolates, colas, especially dark color colas. Many processed foods contain added phosphorus. This can be hard to manage, so check the labels for phosphates, dicalcium phosphate, sodium phosphate. Try to avoid anything with those terms with the phosphate term in it. Your dialysis treatments. Hemodialysis is really good at getting rid of phosphorus, but PD not so much. So ensure that you're having an effective dialysis treatment. If your sessions aren't really clearing your phosphorus levels, you may need to adjust it. Your doctor may need to give you longer, more frequent dialysis sessions. Phosphorus substitutes. As I said, phosphorus-friendly diet, but choose different things like fruits, vegetables, white bread, no wheat bread. White bread. White bread is what you should be eating. Rice over whole grains, rice over bran products, because these things are high in phosphorus. Stay hydrated, especially for PD. If you're a PD patient, maintaining a good hydration level is really, really good at helping to remove that phosphorus in your body. Follow your doctor and dietitian's advice on fluid intake and follow the restrictions that may apply with that. If you're low on vitamin D, make sure you're taking your vitamin D medications. Your doctor may prescribe you activated vitamin D, also known as calcitriol. Other medications can help control phosphorus as well, can help control your PTH if that's too high, which affects your phosphorus metabolism. So just make sure you're taking your meds. Let your nurse know if you're running out of meds. Let the dietitian know if you run out of meds so they can call those refills in. Regularly check your phosphorus levels, check your calcium, check your PTH, check your vitamin D. Know these numbers and know what your numbers are. So you're probably already doing a lot of this stuff, but your phosphorus is a 9, so maybe you need different binders. I don't know what binder you're on, but there's phosphorinol, there's Renvela, there's calcium acetate. There's many different types of binders out there, and if one isn't really effective at lowering your phosphorus, maybe switching to another will help. Have they ever switched your phosphorus binders on you, or did they have you on 2 binders of the same type for months? That's not good if that's the case. I hope that's not the case. So maybe you need a combination therapy. Maybe different binders, Sevelamer with calcium acetate, is more effective than just taking calcium acetate by itself. So talk to your doctor and nephrologist about combination therapies. Maybe I already talked about increasing your dialysis so it can help remove more phosphorus. So maybe you need a longer treatment. I already told you to avoid convenience foods like processed foods, fast foods, canned foods. All that stuff has added phosphorus in it. So read that nutrition label. Make sure you're balancing your protein levels. Protein helps maintain muscle and overall health. Eating too much high phosphorus protein can worsen your phosphorus levels. So talk to the dietitian, Find the right balance of protein that provides nutrition, but minimizes your phosphorus levels. Your dietitian should be your best friend right now. I saw something that said like magnesium supplements can help lower phosphorus. I don't really know if that's truly the case. If you do that, you should definitely talk to your doctor, dietitian, and nurse first so they can closely monitor you and your electrolyte levels. I already talked about monitoring your vitamin D and your PTH. Remember, high PTH levels can cause your body to pull more phosphorus from your bones, which contribute to those high phosphorus levels. So control your PTH by taking your calcitriol or other medications that the doctor is giving you. You can also look at different treatments. So there's a lot of new treatments that are out for phosphorus levels that are really high. I have a patient who started on something called Zofah, XPHOZAH. It's called Tinapanor, something like that. But it's a new treatment to control high phosphorus level in patients with CKD. It works a little differently from phosphate binders. Phosphate binders is in your stomach when you swallow it, and it acts like a magnet or a sponge and soaks up phosphorus as you eat. But this actually works in your intestines by absorbing the phosphorus down there. It's called a phosphate blocker instead of a binder. But you mentioned that your current plan isn't working, and I assume this isn't the first plan, so maybe something different will work. You never know. I had a patient who his phosphorus was like a 10 or a 10.5, and it dropped to a 6. So the downside of this is it can cause diarrhea, which can be controlled with Imodium, or the doctor can actually cut the dosage in half if the diarrhea is too intense, and then slowly can increase the dose. But my patient used Zofah with his phosphate binders, and it dropped a lot. He stopped itching. It was really good. He's been on it for maybe like 3 or 4 months now. So you're facing challenges right now, maybe give it a shot. You never know. Maybe make a food diary for a full week, everything you eat Monday through Friday or Sunday through Saturday, and then give it to the dietitian. Maybe there's some phosphorus that you're eating that you don't even know about. So work with your team. Wish you the best. You're probably itching like crazy. Take care. Ciao.